I would like parents to know, first of all, that if they feel something is wrong with their relationship with their baby, with their thoughts about being pregnant, that there is help available. Certainly there are lots of mental health clinics that can help a mom if she's identified that she's feeling depressed or anxious or just not feeling like herself. There are services such as ours which deal with parents and infants with bonding difficulties. So if the difficulty is identified as when the mother doesn't feel like she feels as close to the baby as she did to her other children, for example, or if she expected to feel close to her baby and doesn't and finds this something odd, then early childhood mental health programs are the place to go for this. People of the diverse cultural backgrounds that we have here often come to Canada with different ideas about psychiatric or mental health services. In some countries, the psychiatric services are for very significantly, chronically, psychiatrically disordered folks. And those of us who have interpersonal difficulties wouldn't dream of going to programs such as those. In Canada, we're very fortunate to have a very broad range of services available, from those of us who want some help with interpersonal difficulties and are functioning reasonably well, through the broad range of people who have very significant mental health concerns. So we have a broad spectrum of services available. We need to make sure that people from various cultural backgrounds know this and that there's no blame or shame involved in coming for assistance. In fact, what they're doing is promoting their child's development, their intellectual, cognitive, physical development, their emotional development as well. For parent-infant difficulties, there are some significant and evidence-based treatments that are available. We begin with working with the parent and infant together. We generally do some developmental guidance, so that is helping the parent to understand the infant's developmental stage. So for example, you wouldn't expect an infant to give a parent a hug and give them some reassurance that the parent is doing a good job when they're 6 months of age, but some parents are really needing and wanting and wishing this kind of reassurance from their infants. Their expectation of what the infant could give them or could provide for them may be very different from what the infant is actually capable of doing. So providing some clarity can be an enormous benefit for the parent in understanding what they could expect and therefore limiting their own needs from their child. Some parents will look for online resources when they're feeling stumped about themselves or themselves and their infant. Some of these things will be very good and some of them won't be very good. A person is best off going to organizations that are evidence and research based, that are well respected amongst professionals in order to get information. So for example, in our region, there are nurses' hotlines, there are professional organizations, so the Canadian Psychiatric Association, the Canadian Psychologists Association, the American Academy of Child and Adolescent Psychiatry, the World Infant Mental Health Associations. These types of organizations that are solidly grounded in research are ones that I would recommend people going to.